With the emergence of a new COVID mutant, the world has gone into a frenzy. On one hand, rich nations rush to offer booster shots to their population, and on the other, even a year after COVID vaccines were approved by health bodies, millions of Africans await their first jabs. Our next report gets you more on the ever-pressing issue of vaccine inequity, its impact on African nations, and the challenges the continent is currently facing.
At the Sekanani Clinic in rural Kenya, they've only got one reliable fridge. And Clinical Officer Gerald Yayale says making sure they've enough COVID-19 vaccine is a challenge.
We do not have a COVID vaccine now. We've run out of stock 5 days ago.
His clinic recently had to turn Kenyans away. But Narok County, where it's located, is not short of shots. 14,000 were sitting in a fridge in the nearest town, around 70 miles away. A mix-up meant Sekanani was not sent enough. This is an example of the challenges being faced across Africa that experts say could have an impact on the pandemic globally. Until recently, vaccine supplies were low, partly due to hoarding by richer countries. Just 102 million of the continent's population are fully vaccinated. That low inoculation rate, only 7.5%, encourages viral mutations like the new Omicron variant. Shortages of funds, medical staff and equipment in some parts have further hobbled getting needles into arms. But with deliveries now finally expected to surge, experts say such weaknesses will be further exposed. Internal documents from the Gavi Vaccine Alliance say a substantial volume will be Pfizer mRNA vaccines, which require cold chain storage. Even Kenya, which has the capacity to store 3 million Pfizer shots, is worried its cold chain will become constrained, says Dr. Willis Akwale, head of the government's COVID-19 task force.
But we must also sustain the childhood immunization programs. So the cold chain is likely to start getting constrained. And that is then going to be the challenge we face.
Another problem is vaccine hesitancy, sometimes driven by religious beliefs or mistrust of Western drug companies. Kenya has ramped up its campaign with television and radio ads and on social media. In Narok, herder Julius Tuyoto says he hears the government warnings. But as the disease has not hit his community, it doesn't feel real.
No one came here. We only hear that people got vaccinated. We don't know why. We only hear there is a disease.
He says he went to a hospital to see if he could get a shot. We were told the vaccine was over, he says. I was not interested in following it up again.
WION is now available in your country. Download the app now and get all the news on the move.